Good morning, everyone. Thank you so much for joining us at this Women and Girls Research Alliance Summit. We are so excited to have you here today. We'll be talking about reporting on the status of women and girls. We have an amazing panel of impressive and powerhouse women who are going to talk to you about their work. I encourage you all to have this conversation, to put your questions and thoughts and comments in the chat, and we will be pulling primarily from the chat. And so we really want to have this rich and robust and important conversation this morning. And I would like to, before we get started, I'd just like to thank Dr. Michelle Meggs, the Executive Director of the Women and Girls Research Alliance here in the Office of Urban Research and Community Engagement, who's really put a lot of her energy and power behind this event. And so we're excited to have all of you here and really, really excited for our panelists today and the conversation that we're going to have. And so I'll start again with an introduction of the panel. And we have a couple of questions that we'll kick off with, and they'll talk to you about their work. And again, just really encourage you to put your thoughts and your questions in the chat, and we'll pull from that as often as possible. And so I'll go ahead again and start with introductions. You all have your program. And so our first panelist this morning is Vikki Crouse, a policy analyst at NC Child and the project director of the organization's NC Kids Count Data Center. Good morning.
Hi, good morning.
Mary Williams Stover is the Executive Director at the Council for Women and Youth Involvement in the North Carolina Department of Administration. Good morning. You're on mute. Let me see if we can.
Good morning. Good morning, everyone. I'm so excited to join you this morning. I want to share some highlights with you of some of the work that we've done at the North Carolina Council for Women. We just won't take a lot of time, but I think that it will help to set the stage for the conversation and also broaden awareness of some of the resources that are available as we think about the impact of COVID-19 on women and girls. If that's
Thank
okay.
you. Yeah, no, we're definitely happy to have you join us. And I'll just introduce Tiffany Allen, who is the Executive Director of Empowerment.
Good morning.
Good morning. Good morning. Thank you so much. And we will start off. We have a couple of questions, and so I'll just, again, in the order that I introduced you, we'll start with the first question. According to your research, what has the past year meant for women and girls, and how has COVID-19 disrupted progress or exacerbated pre-existing challenges or presented new opportunities? And what data-driven trends are you really seeing? So
Yeah,
Vikki, if it's okay, we'll start with you.
Yeah, absolutely. Thank you. Well, what we know, firstly, NC Child is a nonprofit agency that advocates on behalf of children and families in North Carolina. And so we really keep our eye on the policy side of things and opportunities where we can find policy solutions to address things like poverty and racism, structural racism in our communities. And what we know from the pandemic is that it really has touched the lives of every North Carolina family. And as families try to find their footing, we see that this pandemic has put a harsh spotlight on the deeply embedded barriers that create these racial and economic inequities in health and well-being. We know from the data that people who have lower incomes, are Black or Latino, have less college education, or work in face-to-face occupations, have long faced barriers to high-paying jobs and opportunity. And the pandemic, the economic fallout from the pandemic has widened those barriers. One of the folks that I've been paying a lot of attention to, who's been putting out a lot of good research on this, is Janelle Jones, who also happens to be our first female Black woman chief economist in the U.S. Department of Labor. And but even before arriving to the Department of Labor, she coined this term Black woman best in regards to how we should approach economic recoveries after recession. And simply what she means by that is that Black women are really at the center of our economy, right? They have been holding down the frontline jobs. They're running these small businesses, and historically they have the highest labor force participation in among other groups. And so if they are elevated through our policy responses, including everything from paid sick leave to stimulus programs, then the economy at large will benefit. And so when we talk about the impact of this pandemic, we know immediately that it hasn't been felt the same across different racial groups. So, but we can talk more about, what that kind of targeted relief can look like. But those are just some of the things that we're seeing and that we know from previous recessions as well. Unfortunately, Black women have experienced the steepest drop in labor force participation since the beginning of the pandemic, at almost 10% since January of last year. And so that is just one area, the labor market that, we definitely have to pay attention to, as it is an important indicator of our economy.
Thank you. Thank you so much for sharing. Mary, moving to you and your work, same question. What are you seeing in regards to COVID and the disruption in the past year for women and girls?
Thank you. I'm going to attempt to share my screen here and share some of the work that we have done recently with regard to COVID-19 and the impact on women in our state. Let me know if you can see this slide. That would be great.
Yes, we can see it.
Okay, good. It's always a crapshoot. One of the things that the Council for Women has done and with leadership from our board is we've listened to the voices of women in the state. And this report that I'm highlighting here was released at the end of December because the board felt it was really important to take this time to capture what was happening to women in North Carolina. And so in addition to some of the other reports that we have done on the status of women, employment and earnings, and status of women, health and wellness, and then prior to this report, the status of women political participation. What we know is what was just shared is that COVID-19 basically has exacerbated inequality in North Carolina. And it has laid bare what is happening to women. And so we took time and listened and interviewed women across the state. And what we heard is that, I think this quote really sums it up, is that women are tired. Women are working extraordinarily long hours. They're tired physically, they're tired emotionally, they're tired of carrying the brunt of this inequity that has made evident the inequality. And so when we talk about how we build back better, just as you heard, that means we have to center the needs of women, and particularly of Black and Brown women who are really bearing the responsibilities here. And so I just highlight for you some of this information. You can find it on our website, but pre-pandemic, right? North Carolina was not scoring high in terms of how we compared to other states, in terms of employment and earnings progress, in terms of health and wellness, and in political participation. And so that's what we knew pre-pandemic. And so as we look at what the impact of COVID-19 is now and has been, then we see that the plight of women, particularly Black and Brown women, is really at a critical stage. And so solutions have to take into account where we need to be moving forward and have to be aggressive in addressing where we are now. And so I won't go through the entire slide, but I think it's important that you know about it. And we heard from women who chaired the Mecklenburg County Women's Commission, Dr. Yolanda Holmes. We heard from women in New Hanover, who are pictured here, the chair of that Women's Commission, and then the chair of the Durham County Women's Commission, and many other women who are working in their own counties and communities about the challenges and struggles. And so there is a lot of work that we need to do, and a lot of solutions were also discussed in terms of the exacerbation of COVID-19 with regard to domestic violence, hate crimes, the risk of voters intimidation, and then of course, what kind of solutions we'd like to see. And that's the kind of thing that the report here makes evident, is that we need, as you heard earlier, paid leave solutions. We need universal health care. We need to provide support for our care economy and making sure that women who are now isolated know that help is still available in our state. Certainly in Mecklenburg County, you have Safe Alliance and other agencies working on the ground to provide those services, but we know that this isolation during the past year has resulted in even greater domestic and intimate partner violence. And so these are just some of the issues we know that are impacting women and that we need to look at when we talk about solutions for housing, food insecurity. And let's talk about businesses. We hear a lot about businesses closing and what we need to do to help businesses, but women and minority-owned businesses have really borne the brunt of this pandemic. In addition, of course, to needing a solution for educational resources to help our children. So I'm going to just stop here because I don't want to dominate the conversation at this point. I want to hear the questions, but I want to make sure that the listeners who are taking advantage of this opportunity understand that this data is available, and that what the board has made evident from the voices of women is that there are some bright spots in this process as well. We all love teleworking. I think, I won't say we all love teleworking, but it is showing that we can do it, right? I don't know that I'm ready to go back to commuting every day. And so there's some opportunities here that I'd love for us to talk more about in terms of how we keep what's good, but that we also become aggressive in addressing some of these other issues. Thank you.
Thank you so much. Thank you so much. Yes, I'm definitely excited to dive into the conversation. Tiffany, from your perspective, what are you seeing in your work?
Just like Mary, we too listened to the girls and the families that we served. When the pandemic first hit, we immediately got questions about how we can help support just the technology piece of it as kids were moving to remote learning. So we recognized quickly that there were gaps in having Wi-Fi at home, having a functioning computer, or getting access to that computer at CMS. And so we worked quickly to support those families and girls that needed the equipment to continue on with their remote learning. And as we went further down the pandemic, we realized it was taking its toll on our students. We were getting text messages, calls, emails from parents, really talking about the stress, the isolation, the mental toll that it was taking on the girls. And so our usual Leadership Academy curriculum, which is centered around mentoring, we pivot with that and started concentrating on mental health, wellness, and mental health, providing a safe space for students to learn how to cope with what's going on, learning how to build up their personal toolkit on how to save themselves, how to save others around them, and just, everyday things that, how to function through. We really had to listen to the girls because they missed out on graduations and proms and things that really meant a lot in their high school and middle school lives. But we just had to stop our regular Leadership Academy programming and really focus on mental wellness for these students. And so those were the two major things that the pandemic brought up for us, was just, as a leader, you need to be whole, including mind, right? So we're focusing on that. But just the technology piece and being remote for students was a major struggle. And so we just took the opportunity and continued to listen to our girls and our families on their needs.
Thank you. Thank you all so much for all of that insight. What would you say, and kind of looking forward for the next year or the next 5 years, what does recovery need to look like from your perspective and this perspective of your work? And I'll just kind of let you all jump in where the energy flows.
Well, certainly, early education is one area that we know, our childcare industry in North Carolina in particular has been struggling because it's an unsustainable model. We see low, not livable wages for workers, no access to health insurance for childcare workers who have been at the front lines during the pandemic, and unaffordable childcare costs, frankly, for most families. And yet, even with that, we know that the research shows that quality childcare has really good long-term impacts on children's health and education and well-being. And so we want to invest into this industry. It also means that families, particularly those who have seen that labor market disruption in their own household, are able to hold full-time jobs without having to, stay home or worry about childcare, work less hours. It means that families can achieve more, financial stability because of that. And so, what I think is this pandemic is really providing an opportunity for really bold, transformative action in some of these systems that for so long have been just kind of, struggling, frankly. And that may look like universal pre-K in North Carolina. But this is really an opportunity for us to course correct from one of the worst economic downturns in our country in a way that actually gets to some of the root causes for, the racial and economic disparities that we see in our society. And that includes, having transforming our early education system.
Mhm.
Yes, Mary, I hear you
But
affirming.
amen, amen. Yes, everything. I mean, when we talk about Build Back Better, it's everything from universal health care coverage, achieving that goal, to mandating paid family leave. And this is not just a women's issue, this is a family issue. We've seen with COVID-19 that when you have to leave the workplace to care for your child or your parent, that not only affects women, it affects fathers, it affects the whole family. I mean, so providing that safety net is going to be essential. And then sustaining funding for nonprofits who are talk about pivoting. We heard Tiffany in her work. Nonprofits have really had a struggle right now. And thinking about domestic violence and sexual violence programs, fortunately, they received funding through the CARES Act, but that funding will not be sustained at that level. Yet the need to work differently, work from home, provide telehealth support, telecounseling support, all of those needs continue. So we need to look at that kind of continuation of support for nonprofits as well.
Thank you for acknowledging that, Mary. Yes, that's a whole nother topic and conversation that we can go down on funding for nonprofits during the pandemic. But my hope is that, that the education system for our youth, and especially for our girls, is just reevaluated and reprogrammed. Our students learn differently. And I don't think that has been captured in the past, but we've seen that now during the pandemic, as some students prefer to be in person, some students prefer to be in a hybrid model, but to recognize the different learning methods for individuals and to be able to have that opportunity available across the school systems for every individual learner.
Mm-hmm. And that reminds me, speaking a lot about telehealth and knowing that the vast majority of students are still in virtual schools. Unfortunately, over 200,000 households in North Carolina still don't have access to bandwidth, to internet and broadband internet. And so that's a huge crisis that we're seeing there too, because we know that teleworking and telehealth isn't available for every family. A lot of families are doing all of this stuff on their phones. In parking lots where they can get internet access. So bringing broadband internet to all the households in North Carolina is certainly another really big priority.
Absolutely. Absolutely.
Absolutely. And I want to encourage our audience our participants to please ask questions and put them in the chat, make comments. And so we'll be monitoring that as well. Talking about some of the overarching themes that you were just mentioning from a recovery standpoint, are there any current sort of policy or legislative work or action that we need to take as advocates for women and girls in these issues? Can we, contact our elected officials? Are there any places where we can currently apply pressure to move some things forward from y'all's perspective?
Well, there's so much that we can do as citizens, right? That's the beauty of the democracy. We know that Governor Cooper has put forth ideas and the need for Medicaid expansion. That is definitely an area and an opportunity to support more families and women in need. We also know that getting women at the decision-making table is important, whether you're talking about boards and commissions, whether you're talking about actually running for office, whether you're talking about contacting your legislature and talking about some of the recent legislation that has been put forward in terms of supporting moms. I know Representative Alma Adams has put forth a momnibus bill, which is kind of forward thinking there. And so the Crown Act has also been put forward in terms of ending discrimination for women of color based on their hairstyles. There's a lot of good work that legislators are doing. And what I've heard is legislators want to hear from their constituents. They want to know what's important to you. And so beyond voting, so much of our energy goes into voting. And now is the time to follow up, right? And to have those conversations with legislators so that we can address what's known as the she session, right? Vikki talked about the number of people who've left the workplace and the number of women who've left the workplace. So we need support for those women to be able to return to the workplace, whether that's an audit by their organizations, whether we resume conversations about increasing minimum wage. Those are all of the kinds of conversations that need to occur on an ongoing basis.
Absolutely. And, speaking of the minimum wage and just the labor force in general, women are largely, unprotected in a lot of workspaces. And a lot of the industries where we see women, and particularly women of color working, are places that have historically been left out of federal law when it comes to labor protection. So the Fair Labor Standards Act passed decades ago left out at the time folks who worked in did agricultural labor, domestic service labor, areas where traditionally we saw a lot of Black folks working. And so now we know that, looking back on it, how racist, frankly, that was. And long past time that we revisit, our Federal Labor Standard Act, revamp it for the 21st century, make it inclusive to workers of color. And so it's really disappointing that raising the minimum wage to $15 an hour was excluded from the latest American Rescue Act, because that is certainly something that we need to see in our country, and especially in our state. As Mary said, Medicaid expansion is huge, and recently with its American Rescue Plan was included a $2 billion incentive for North Carolina specifically, and as well as billions of dollars for other states who have yet to expand. We're more and more in the minority of states that haven't done so. $2 billion federal dollars that we could pull down if we expanded the income eligibility for Medicaid. More than 500,000 people in our state who would be newly eligible for Medicaid if we were to expand. So this is huge. And right now, North Carolina is in the early part of our long session, what we call the long session that extends through the summer. And so right now is a time to reach out to our legislators and ask for them to put introduce a bill to expand Medicaid and actually take advantage of this opportunity that we see right now. But right now, speaking of the American Rescue Act, as it moves through Congress and eventually gets signed into law, our state legislature is going to be the ones that make the decisions about how a lot of the funding is allocated. And so again, this is a huge advocacy opportunity for us to reach out to talk about childcare dollars, to talk about these block grants that are going to be disseminated at for higher education and other things like that. This is a really big moment for us to have a huge impact in terms of how those federal dollars are spent.
Thanks for sharing that, Vikki. And also just recently, the Congressional Caucus of Black Women and Girls announced that they've completed their report on not only the state of Black girls and women, but an action plan that can be executed across the country that touch upon areas of Medicaid and Medicare, generational wealth, everything that you've listed. So I'm excited for that report to come out and to see what it entails and to take some of that actions that they've listed to task.
And I don't want to leave out our girls. Our girls are really struggling. Having the isolation has caused a lot of anxiety for girls, as you talked about earlier, Tiffany. And so there are excellent programs that need support. One of our current board members is with Girls on the Run, and she talks about the need for programming and a plan to help girls and the benefit of physical exercise to relieve anxiety. And helping parents who are struggling right now in terms of having a normal schedule, right? And so we don't want to lose girls. We want them to get the education they need and to thrive in a way that supports them. One of the programs offered by the Council for Women is state youth councils. And so we work with youth councils around the state, and those councils provide leadership training and leadership engagement and community service engagement. And so all of those kinds of opportunities are there for girls, certainly for boys as well. And Girl Scouts continues to do some phenomenal work, internships for college students right now. So those are some of the kinds of programs that we need to continue to support: paid internships, opportunities for our college students, our middle school girls to learn and to get engaged in a way that fosters their future development.
You're absolutely right, Mary. There's still organization activities that students can participate in during this time. It may look a little bit different, but the goals are the same of, getting physical activity via GOTR, Leadership Academy with empowerment. So activities are still going on, and it just looks a little different, which is okay. But the girls can still virtually social or be outside with their family and do social distant activities or just activities within their neighborhood to remain normal, if you can say that, but can still continue to thrive on extracurricular activities outside of their remote learning. And then, for example, empowerment, we are continuing with our mentoring piece. The mentor and the mentees are meeting now virtually, of course, and that's worked out a little bit better for our girls and our mentors. They can, Zoom with each other before classes start, more frequent on the weekends. And so there's opportunity that is still happening on empowerment side, the mentoring piece of just still fostering relationships outside of the home and providing a role model for the student.
Mm-hmm. That's wonderful. And certainly from a policy standpoint, putting more funding in these, public-private partnerships with nonprofits who are already on the ground doing this really excellent work. Mm-hmm. In the K-12 space, that also looks like putting more funding towards school nurses. Right now, our school nurses are really stretched at capacity. One school nurse per, 20, 40 schools. And so that makes it impossible for them to actually deliver, high quality care oftentimes to the students who need it, who are in mental health crises. So we need more school nurses. And unfortunately, in recent years, the data shows that youth suicide has become one of the leading causes of death among children. And so certainly this pandemic has exacerbated depression and anxiety among our youth. So we're facing a mental health crisis that we need to address.
Mm-hmm. Absolutely. We have a question in the chat from one of our colleagues here, and let me just pull up the question. Great conversation. What are some of the shifts or lessons learned that we should keep or carry forward in some way? For example, education sees less gender disparity in math in the virtual environment. So what are the things that, you know, as you might have alluded to earlier, what are the shifts that we've learned, and how can we move those shifts forward? And what are your thoughts around that?
Well, one of the things we asked in the report that we were doing, we asked the people that were interviewed, is that question, what would you like to keep? Is there anything you'd like to keep? And what we heard was the flexibility, right? What this has proven is that people can work from home if they have the opportunity, or at least their organizations can allow the flexibility that's needed. And so many women talked about wanting to keep that kind of work schedule. The other thing that I think we've learned is that coalition and cooperation is very essential. We have to continue to help each other and work together. This whole notion of work-life balance, I mean, we're out of balance. That's just the reality right now. So as we resume, the vaccines happen, and Secretary Cohen is doing a great job, and her team. We need to ask ourselves, what can we keep right now? And so I'm seeing more and more people participating in meetings like this because they're more accessible, not for everyone, but at least having the variety of learning tools and keeping some hybrid of this process is what we know will help us as we build back better, if you will. And I think there's been an increase in participation. More women are getting involved. And so we want to see that continue as well.
Mary, I agree with you. Empowerment will continue to be in a hybrid module here. As with the pandemic, we have been able to form relationships across the globe. And that was a little bit harder to do prior to the pandemic, but being virtual has allowed our girls to connect with women in Africa, women in Sweden, just across the country. And that all happened because of being on a virtual platform, and people reached out to the organization wanting to connect with girls and other women. And so we will continue to keep that, as well as just our collaborations with other nonprofits. We know that we don't do it all, and we are not trying to do it all, but we do work very well with other organizations and other entities that provide exposures and experience to girls and women. And so those collaborations, that thought process of continuing to collaborate with others will continue past this.
Yeah, absolutely. And, you know, thinking back to our discussion on labor, certainly the lessons that we should learn from this pandemic is just how exposed and vulnerable our frontline workers are, and how unprotected they are from something like, you know, contracting COVID-19, where most of them, minimum wage earners, don't have health insurance, don't have employer-sponsored health insurance, are in the coverage gap for Medicaid. So what happens when they fall into a crisis like this? They're the ones that are impacted the most, and their families are the ones that are impacted the most. So we need to learn from that, and realize just how much we need to protect our workers during flu season in particular, and beyond. And also in the healthcare front, you know, we've seen a lot of these adapted telehealth hybrid models. Obviously, all medical care can't be provided virtually, but in cases where it is, it's meant that, you know, parents in particular have been able to access well child visits, other sorts of screenings through virtual health models, and not have to, you know, take off several hours of work to take 2 buses to their doctor's appointment. And particularly for people who are enrolled in Medicaid, we see a lot that, you know, there's one provider per, you know, county, sometimes in more rural places. And so folks, it's just really accessible. And so these models are really great, and we should make permanent going forward.
So that care economy and the child care support and affordable and quality child care is just essential We just have to have that kind of support if we're going to build back better in our state. And then also just looking at some other ways to, as you said, continue, whether it's telehealth, whether it's continuing to, and definitely keeping in mind always the inequity, right? And so even as we look at the current legislation that's moving forward, we know it won't reach everyone, right? And so we have large Latinx communities that will not be able to take advantage of some of these resources that are available, but still have needs. So we have to center the needs of Black and Brown people, but also immigrant populations and others, and make sure that we have support systems in place to be able to support their needs.
Absolutely. And I wanted to, Mary, give you the opportunity. I know you had a question for our participants or those joining us. I wanted to give you an opportunity to ask that question, and then we'll continue, of course, with questions from the audience.
Well, I'm always interested in hearing what others are doing, right? So I'd love to use this as a forum to hear from our audience in terms of what are you doing during this process of COVID-19, and as we move forward, what are your organizations doing to build back better and to overcome the inequities that we're seeing right now?
So if you can put your thoughts in the chat, and we can certainly, have that as part of our conversation. So please don't be shy about doing that. And in the meantime, as that chat populates, we have another question from the audience. And so if that's okay with our panelists, we'll please encourage you to put your thoughts and put your ideas in the chat. And we will move to this question. I'm impressed by the commitment of your organizations to include the voices of women and girls in guiding your work. Do you have examples of new strategies and solutions that were actually co-designed and implemented with the leadership and expertise of the women that you work with?
Well, co-designed. Some of the programs that we have operated at the North Carolina Council for Women, all of our programs actually have the input of board leaders and members who are appointed by the governor, the Senate Pro Tem, or the Speaker to bring the citizen voice into the equation. And so the state internship program is a great example. Even though COVID impacted the program and students were not able to go on site to volunteer with state agencies, we were able to pivot and to offer the program virtually. So 10 weeks of internship learning about the workings of state agencies still occurred. And actually some of the students said for them, it removed barriers by having the program offered virtually because they were worried about housing and how they were going to manage housing and transportation costs. And so that's just one example of a cooperative design that involved members of that board working with the Council for Women, which is a state agency, and figuring out how do we continue to offer this valuable learning experience during COVID. And now as we move forward for our next summer internship program, we're looking at a hybrid model, right? Students and placement sites can decide, are we going to offer virtual or will it be an in-person program? So that's just one example of how we've moved forward in a cooperative manner.
Yeah, and in North Carolina at the state level, the perinatal health strategic plan is something that was born a few years ago to really tackle the racially inequitable outcomes that we were seeing in birth outcomes and women's mortality at birth, and is really led by a lot of women across both state public health agencies, but also nonprofits like NC Child, which is also women-led. And so you see a lot of that because mostly women are at the table, the way that we're able to center the needs of women and pregnant people, because we know from experience what those needs are. Another area that NC Child has been working on is a health equity impact assessment, which was born out of a cooperation between the Division of Public Health and NC Child. And it's a tool for state agencies, but also nonprofits and other groups to use to assess policy solutions, program practice, and actually understand if it's racially equitable, what we're doing in our communities. So, I'll take this as a moment to plug it and say it's a free tool for anyone to use, but it's also just a great example of what happens when, you have women at the table.
When our girls watch the Black Lives Matter spill over into the news and become more of a conversation and a highlight and a real thing for them, we took note that our leadership curriculum was only touching the surface on social injustices. And so we're in the process of working with our local Black Lives Movement organization, as well as voter registration, as that was also another high topic for the girls as they watched the 2020 elections unfold. And so we're just putting together pieces into our curriculum to provide them with a deeper knowledge and understanding of the inner workings of our election process and voter registration, as well as why Black Lives Matter exists, why that movement exists and will continue to exist. And so those collaborations are continuing today.
Fantastic. We do have some comments here in the chat. And I think in response, Mary, to your question as well. And so Kimberly Keefe from Girl Scouts says that Girl Scouts were looking for ways to reach out to our volunteers, knowing that the majority of them are women and have been greatly affected by the pandemic. We want to make volunteering with the organization that a lot of our volunteers, as easy as possible, with the knowledge that a lot of our volunteers have felt overwhelmed by the changes in their lives.
Mm-hmm.
And she goes on to say, we're offering trainings for volunteers that focus on diversity, equity, and inclusion for our volunteers, and more programs for the girls that have that focus as well, that diversity, equity, inclusion focus.
Mm-hmm.
Thank you so much for that contribution. And again, I encourage more of you to put ideas and thoughts into the chat in that way. And I wanted to talk again, as we do encourage you to ask questions of our panels, comments, your own ideas and your own actions, and talking a little bit more about with our panelists about that. I know, Tiffany, you talked about the pivot that your organization did and had to do very rapidly. It is. I thought about this, as we started this conversation this morning. I think it was almost exactly a year ago today that I got an email from the university saying that we were moving on a Monday. I think it was an email that came out on a Wednesday, and on that Monday we're going to shift everything. And so thinking about the mood and the atmosphere at this time almost exactly a year ago, can you talk about that moment for you all in your organizations as you have had to sort of make this sort of pivot, and what that felt like, and what does the moment now feel like for you and the work that you're doing?
Just a year ago, we Empowerment celebrated International Women's Day with an in-person event. And literally 5 days later, the world was shut down, and it was very unreal. The assumption was that it was going to be temporary and painless, and it was the complete opposite as we sit here today. It was surprising to see that it was very painful, shocking, and jarring for our students. We didn't have the words to prepare them. We didn't have the words to let them know were all in this because we were all trying to figure it out for ourselves.
Mhm.
But it was just a difficult time. And
Mhm.
one of the things that we were to experience in March of last year was an in-person tour at UNC Charlotte. And that
Mm.
to a virtual tour, they were already set up to do a virtual tour, which I thought was so impressive. But again, the girls were very disappointed that they couldn't be on campus, couldn't experience campus. And so just we quickly had to, live in this virtual world, but we had to gather ourselves and be role models to the students and say, hey, we're in this too. We're trying to figure out day to day too. We're stuck at home with our families too, so we get it. And so nothing could have prepared us for this, but I look back and I see that our girls are stronger. They're more agents of change as they have seen so much unfold in front of them, in front of their TVs, on social media.
Mm.
And so they are wiser women and will become these trailblazers and champions in the community that we hoped that they were going to be anyway. But they're just so armed now with all that has been unfolded in front of them. And so was not ready for what last year brought us, but we are standing here today and our girls are stronger and our mentors are stronger for it.
Mhm. Yes, Women's History Month. We were planning our Women's History Month celebration with the Girl Scouts as a partner. So excited about it, and that we had to cancel that event. And that was the other thing that was happening is that a year ago we were seeing events canceled. Every day organizations were saying, "Oops, we're going to have to postpone." Some postponed. Just sort of like, we don't know how long this thing is going to last. We're going to push it back a month or two. But for us, we were deep into planning for Women's History Month celebration. And here we are now in Women's History Month a year later, and we're recognizing it virtually, right? And so this is our new normal. And the impact for us as a state agency has been to pivot and to look for how we can continue to serve the citizens of North Carolina. The one thing that we were starting to embrace was Microsoft Teams and doing meetings virtually, because we do have at the Council for Women team members who are in Asheville and Greensboro and New Bern and Charlotte. And so the state was actually looking at how to beginning to embrace Microsoft Teams, and thankfully that system was in place. And so it gave us a platform to be able to move forward using this system, which we now learn that is possible, not ideal, but possible. And our volunteer board meetings, our boards and commissions continued meeting virtually. And so that was a journey, working with board members and making that transition, whether it was the Domestic Violence Commission, which meets quarterly to look at issues and needs impacting domestic violence programs and survivors across the state, or the Council for Women board led by phenomenal Jenny Black. But we all made that shift, but at the same time, I remember the words of my manager who said, mission first, people always, right? The people are what matters. And so we just talked about earlier the tremendous challenge that women have faced as caregivers, as the people who are bearing the brunt of this COVID-19 health crisis. And so you can't be an organization and not keep in mind, how are your people doing? How do you support the people? How do you provide those kind of systems? And so I'm real proud of the governor and the flexibility that was provided as we started to look at the kind of support systems that our employees needed in order to continue to take care of their families, but also to be able to do their jobs and serve the citizens of North Carolina.
Thank you all so much. We have a question from our own Dr. Michelle Meggs. How can we build effective partnerships that will help women and girls reintegrate into the work and school and in ways that are healthy and productive?
Mm-hmm.
Accessibility, which is something that we've talked about today, is really important. One of the things that we did with the shift to more virtual work was keeping on retainer a translator, a Spanish translator, so that we could integrate that into all of the public facing work that we do. We have a parent advisory council that is made up of, includes women who speak Spanish. And so being able to make those spaces more inclusive is really helpful for building meaningful, long-lasting partnerships. Encouraging community members or whoever you invite to the table to lead the conversation and to lead the agenda is also really important. We think a lot about how we can do good ethical work in community, and that involves letting folks lead, letting directly impacted people lead. And providing support when we can. But I think those are two things that, you know, we still are working on doing, and would encourage others to as well.
Absolutely. Just continuing to support policy changes and recommendations and listening. Access is still a huge opportunity. I won't call it an issue, it's an opportunity to make sure, as Vikki said, we are broadening access. One of our programs, the Family Violence Prevention Program, is being real intentional as we look forward to grant making and challenging us to find opportunities that are promising practices that are meeting the needs of marginalized communities specifically, right? Because it's one thing to talk about inequity, and it's another thing to actually identify solutions that then we can support with funding. And so that's the kind of work that we're looking at doing moving forward. And then just continuing to innovate and look for opportunities to remove some of those barriers. Like transportation is still a huge issue for many people, right? And so how do we continue to remove some of those barriers that prevent people from getting access to services? Those are the kinds of questions we have to continue to ask ourselves so that we can build back better and be the best place for women to thrive.
Totally agree, Mary. You mentioned funding and the resources to organizations. Community giving to girls serving, women serving organizations is very low. We're the lowest on the totem pole when it comes to community giving. And so the additional resources and the funding for organizations like Empowerment and others are definitely needed. And then just creating experiences, roles, and paths for girls to come and sit in, to be in that space, to be in that job, to be in that role. That just has to happen. It doesn't have to be a conversation, several conversations on we need more girls in math or STEM. Bring them to the table, bring them to the science lab to learn. They don't know what they don't like yet until they're in front of it. But truly create that opportunity for them to be exposed, to be connected to other women, and just men. We need men advocates as well to support the growth of girls and women in our society.
Mm-hmm. Yes, there's so many opportunities. Women's commissions across the state. We're encouraging organizations of women. If you have a women's commission in your county, get involved. If you don't have a women's commission, contact us and we'd love to talk to you. We're putting together resources to encourage more counties to create women's commissions. We just want to have opportunities for voices of women to be heard at policymaking levels, and also just know that we are in this together. We absolutely are. So collaboration is happening every day. And I'm so excited about collaboration as we move forward. We're working now on our next Status of Women report, for which will focus on poverty and opportunity. And we're looking now at rural communities in the county so that we can bring in that voice, the voice of rural North Carolina. So we don't lose sight that what's happening in the metropolitan area is not what's happening all over North Carolina, that we have to have a broad voice that's represented when we look at policy and we look at recommendations.
Great, thank you. I know we have about 5 more minutes. We do have another sort of question comment in the chat, so I will read that. For a program that relied heavily on teachers and school partners to communicate programming options to historically underserved communities, we have found it particularly challenging to promote out-of-school enrichment and scholarship equitably. It is especially important for us to provide support to those disproportionately impacted by the pandemic. What are your thoughts on overcoming challenges distributing information that does not rely on technology access?
Well, I can just tell you that one of the things that we've seen is back to old school information sharing, right? Domestic violence, sexual assault programs, our human trafficking initiative partnered with media to do public service announcements, radio announcements, making sure that people heard help is still available during the pandemic. We see agencies that are going back to using mailers to send information to people's homes. I'm so old school, I love magazines. I will read a newsletter that I can hold every day and carry around. And so some of those opportunities are there, and they're being used quite effectively now in terms of public awareness and outreach.
The same, we've taken to mailers, postcards to the girls and to the students. We have a partnership with Clayton County, Georgia schools, and the middle school principal at Rex Middle School there is literally in her car once a week, driving through her students' neighborhood, passing out PPE, passing out candy, whatever she can give the students. And so she knows that her students are, they're a Title I school. And so they're in neighborhoods that have challenging technology. They're without the proper Wi-Fi and things like that. But she makes it a point once a week to go out there and be with her students in some form or fashion, whether it's sticking something in their mailbox, providing them with stickers, candy, whatever, just to keep them engaged, to know that the school is thinking about them and trying to support them the best way that they can remotely. But we Empowerment here in a couple of weeks will be sending out postcards to those students as well, because again, they like to get mail. And it's just a easier and a different way to support the students.
Mm-hmm.
And meeting people where they are. If you're targeting, you know, an important direct service, like trying to get information out about intimate partner violence, resources to women in the community, going to the food banks where people are still going to these places in person, or a local health department sticking a flyer up on a bulletin board. So still doing some of that, as Tiffany said, in-person contact as safely as possible is what it takes sometimes to reach folks.
Well, I know we're almost out of time, and so I want to thank all of you so much for your time, both our participants and our audience, as well as our panelists. It's been an honor to really be in this conversation with you, and I'm just in awe of the work that you are doing and are doing, particularly at this time in our history. So thank you all so much. I do want to point out in the chat that there is a link to a post-conference form that we would like for you to fill out. So if you could please fill that form out. And again, thank you so much to the panelists. Thank you to Dr. Meggs for pulling us all together this morning. And again, it's just been a real pleasure to have this conversation with you this morning.
Excellent. Thank you. Thank you all.